National Indian Health Board. It's my pleasure to welcome you to the Tribal Health Equity Summit. Before we begin, please note that this session is being recorded. If you do not consent to being recorded, you're asked to drop off the session at this time. Thank you. As is customary, we will start this meeting in a good way with an opening prayer. We're grateful today for everything we've been given, including this breath of life, the water, the medicines we pick, the medicine of time, and the medicine we are to each other. We ask for very little for ourselves today as we appreciate the opportunity to come together any way we can on behalf of our relatives. We ask for blessings, Creator, and prayers for those less fortunate than us, ones who are not feeling well, our veterans who struggle, and the children who need our help, babies who are coming towards us, and those who don't have enough food or clean water, and relatives who are incarcerated or fighting addiction. Guide us along in our work today, Creator, creation. Yawagoa Sequoia Diesel. Thank you. To start us off today, I invite Carrie Field from NIHB to share some opening remarks and provide an overview of today's events.
Thank you, Chief Cook. So I'm Carrie Field. I'm a policy analyst with the National Indian Health Board, and I'm our health equity lead. So I'm very excited to welcome all of you to today's event. Recognize that this is a significant amount of time that you've agreed to join us for, and that we're really excited for the discussions that we're going to have today, and your input here is going to be really important. So after all, today is a summit, not a webinar. So your participation is really going to be key to making sure that this is a successful event. So part of that, one of the tools that we're going to be using to facilitate our discussion is called Poll Everywhere. And so you can join that through your web browser. The instructions are there on the slide. You can go to pollef.com, enter NIHB, and it will have the first activity there. So that's a way for everyone to be able to participate throughout the meeting. We'll have a few different opportunities and activities to get your participation there. So if we want to go to the next slide. So here's our first question, so you can practice using Poll Everywhere. So you can just, when you get in there in your web browser at pollef.com/NIHB, you can just click on the map wherever you're joining us from. We'll give everyone a few seconds there to practice using it. And
can you name that website again?
yeah, so it's there at the top of the slide, but it's pollef.com/NIHB.
It's asking for a login.
It shouldn't.
Mine did that for a second too. It said wait for NIHB to start, and then it did pop up. So give it a little second again, or you can put it in the chat if it doesn't work. But the same thing happened to me, Chief Cook, and then it did.
So the link is in the chat there, and any of the discussions today, if you'd rather respond in the chat, that's also fine. We will be recording everything that goes into the chat.
Okay, here we go.
I think I got it.
Okay.
Thank you.
That's why we're doing a practice. So we've got 242 people joining us so far, and you can see that we're all over the country. So this is really exciting to see where we've got everyone from. So that will help us to have a really rich discussion since we have so much diversity here. Looks like we're still getting some more pinpoints joining, so I'll wait a little bit longer. Oh, there we go. And we'll have a few different types of activity. So we'll go on to the next slide and you'll get to try another type. So this one, you can just type in any word or phrase that you think comes to mind when you say, what does health equity mean to you? So we're seeing a lot of words around opportunity, access, equal, justice, care, wellness, traditional healing, medicine, safety, compassion, inclusive. And we see we've got some other comments in the chat too. Thank you for those. Thriving. So there are some really great themes going on here. What health equity means to us. What a great way to start. Okay, so let's go on to the next slide here. So as we're getting started, I want to provide a little bit of context about where this event is coming from. So this really is a continuation of several discussions that have been going on around Indian country, several that NIHB has had the privilege to lead and to host. Including in May, we held an Intertribal World Cafe on health equity, where we gathered a lot of people virtually, similar to this. It was open to whoever wanted to join. So it had folks from across Indian country and then some participants from various government agencies as well. And we really looked at what are some of the key drivers that are contributing to the health inequities that we currently are experiencing in Indian country, and what are some of the paths forward? What are some strengths and assets and themes that we can lean on as we're looking at crafting a future of health equity for Indian country? So I'm going to share just some of the outcomes from that discussion as we're getting started to provide some context for today's discussion as well. So in the next slide, so as we were looking at key drivers of health inequities, really one of the most consistent themes that comes out is that all of the inequities that we're experiencing today are rooted in a history, and that all of that history comes out of colonialism. And one of the biggest impacts that colonialism had as it brought all of these different changes to Turtle Island was that separation of American Indians and Alaska Natives from community identity and culture, and through many different means that was accomplished. But that separation, as the discussion revealed, is really at the root of a lot of the problems that we're continuing to see, and that separation continues to this day. So on the next slide, because of colonialism and the different systemic injustices that were introduced, those have led to these self-perpetuating systemic barriers that American Indians and Alaska Natives continue to face. So across Indian country, we see generational poverty. We see nationally the erasure of American Indians from the national consciousness. There's distrust that has grown as a result of this history between tribes and other governments. There's disparities in opportunities, not being able to access education, jobs, and healthcare, exclusion of tribes from decision-making, data practices that exclude American Indians and Alaska Native from representation, and severe underfunding of the public sector. And so the ultimate outcome of all of those ongoing systemic barriers are these health inequities. So we see that because of these systemic injustices, that's where we're getting these higher rates of preventable disease, disability, and death. And so those are, the discussion was a lot, was really rich and included a lot more than that. So AC just shared in the chat where you can find the additional resources that we're looking at today, is we're including additional details that go along with this report. So this is just a kind of high level summary of it. So those were some of the key drivers that we looked at. We also didn't stop the discussion there. We also looked at what are the paths forward? How can we lead to health equity for Indian country? So the next slide, there were 5 major themes that came out that were very consistent across all of our different discussion groups that we had, as things that are really key components as we're looking at a path to health equity. So the first is tribal sovereignty, the idea that respect for tribal nations as sovereigns and expanded tribal self-governance are foundational to American Indian and Alaska Native health equity, that's always going to be a key component and it can't be left out of any discussion. A second piece of the path forward is resilience through culture. So there was a lot of discussion around how leaning into traditional values and worldviews is how we can open up new paths forward, that there are strengths and resources there in our heritage, in our Indigenous knowledge, and that's in our Indigenous identity, and that's how we're going to move forward. There was also discussion around strong tribal institutions that with collaboration, emphasis on traditional values, and prioritization of health and well-being, tribal institutions can be a powerful force for American Indian Alaska Native health equity. And so strengthening those institutions is a really key part of making progress. So that includes our tribal governance, our tribal healthcare systems, our schools and colleges, our justice systems. So all of these different pieces, and our regional and national organizations that support advocacy and epidemiology and all of these other great services that we contribute to. And then the next slide. So then the other 2 out of the 5 key themes that came up, tribal representation in state and federal governance. So a lot of this idea around that undoing centuries of harm to American Indian Alaska Natives requires dedication to rebuilding relationships and trust and purposeful inclusion of tribes in decision making. But that is not something that's going to happen overnight, that it takes a lot of dedication and a lot of intention to be able to accomplish. But that representation is really crucial in order to being able to move forward on a national level. And then in addition to that, the federal trust responsibility. So ensuring that the federal government is upholding their treaty obligations, their trust responsibility, making sure that there is adequate funding in tribal systems to support all of those tribal institutions, making sure that our data practices are representative and are supportive. So all of those other pieces that fit as part of the federal trust responsibility. So those are 5 of the themes that came up during that conversation as parts of key components of the path forward to health equity. And we're really looking forward to seeing what else this conversation today will contribute to this. What else do we need to be thinking about as a path forward? What do we need to have in mind? What are the roles of our tribes, of our tribal organizations, of state and federal agencies? Everyone has a role to play in health equity. And what does that look like in this context as we're looking for American Indians and Alaska Natives? Because we know this context is very specific and is unique to a lot of the other conversations in health equity. So you can see from some of these ideas that have come out of both the key drivers and the paths forward that there definitely are some themes that are that you would see come up in many conversations nationally about health equity. But you can also pretty clearly see that there are a lot of things that are unique when we're talking about American Indians and Alaska Natives. And so the approach to health equity in Indian country is going to look different than it might for other groups. And so that's going to be an important part of our discussion today is what does health equity mean for Indian country, even down to the language that we use as we talk about it. Is health equity the right phrasing to use? Is there something better? What does it look like from a tribal perspective? So the next slide, please. So throughout the day, there's a few phrases that you'll hear a lot. So I wanted to make sure that we highlighted them at the beginning. So one, social determinants of health is a phrase that's often used in discussions around health equity. And that's really referring to factors that are outside of genes and healthcare that influence health. So it's the idea that where you live, learn, work, and play, all of those factors influence what your health status is. And this diagram image that you have on the screen comes to us from a conference with First Nations in Canada. So you can see some of the things that came out of those conversations, looking at social determinants of health from a First Nations perspective. And you'll see that there are some pieces on here that are not always traditionally included in kind of more general discussions around social determinants. And so part of what we want to look at is what are determinants of health that are really significant when we're working from a tribal perspective. Does it make sense to keep using the same language of social determinants of health? Should we use different language? And then what do we need to make sure that we're including as all of these different forces that are impacting our people's health to make sure that we're seeing the whole picture and we're looking at health in a really holistic way. The other important phrase I want to make sure everyone's familiar with is CMS, which is the Centers for Medicare and Medicaid Services. A lot of the discussion today will be looking at how Medicare and Medicaid policy can better support American Indian and Alaska Native health equity. So next slide, please. So as we're looking at the day, all of the summit materials can be found online at the link I believe it's been shared in the chat also, but NIHB.org/health-equity. And so there you can find the resources, you can find today's agenda, bios of the speakers, everything you might need for the day. So as we're looking at the agenda, we have our introduction to the topics of the day. Our next, then we'll move into looking at what it might mean to craft a tribal definition of health equity. We'll hear from some keynote speakers and have a moderated Q&A session. We'll then move into looking at CMS policy recommendations. We'll have a panel discussion, and then we'll have breakout sessions, and then we'll wrap up the day with a panel discussion around improving data. So we're really looking forward to all of these sessions. There should be some great discussions to be had. We have some really exciting speakers on the docket for the day, and we're really looking forward to your participation as well. So next slide. So our summit goals are to advance the national conversation around a tribal definition of health equity and to create policy recommendations for Medicare and Medicaid to better support health equity for American Indians and Alaska Natives. Okay, so to start us off with some opening remarks on how the Centers for Medicare and Medicaid Services are making health equity a priority. Our first speaker will be Dr. LaShawn McIver, the Director of the Office on Minority Health for Center of Medicare and Medicaid Services. So we can go to the next slide. Thanks. Dr. McIver is a proven public health leader with experience in driving successful health initiatives and public policy efforts aimed at promoting health equity, improving health outcomes, increasing access to care, and promoting health system reform. She provides leadership, vision, and direction to address CMS minority health and health disparity goals, participates in the formulation of CMS goals, policies, and strategies, implements activities to monitor CMS health equity programs, and consults with federal agencies and external organizations to address health equity. Under her leadership, the CMS Office of Minority Health has initiated an agency-wide approach to health equity across all CMS programs. This includes implementation of the executive order on advancing racial equity and support for underserved communities to ensure our population's voices are represented in all aspects of the agency's work. So welcome, Dr. McIver.
Thank you so much. And I am truly honored to be here today. And I'd like to thank Chief Cook for the opening remarks that she provided as well. As noted, my name is Dr. LaShawn McIver, and I'm the Director for the Centers for Medicare and Medicaid Services Office of Minority Health, or CMS OMH. and I lead the agency's efforts to advance health equity across all of our health programs. I, again, truly appreciate the opportunity to present some of the exciting things happening across CMS relating to health equity, and appreciate the feedback that we've already received directly from NIHB, which will help us shape our future efforts. So again, thank you so much for the invitation to participate today. I'm here not only to share information, but to certainly learn from those who are joined today as we are thinking about the work within health equity work within CMS. Next slide. So my goal in the next few moments is to introduce to some and reintroduce to others CMS's strategic health equity efforts, which are anchored by the CMS framework for health equity. I will be discussing CMS OMH's equity aims, particularly as they relate to CMS's framework for health equity strategy, and how the priorities outlined by NIHB can be applied to further health equity for American Indians and Alaska Natives. Next slide. So CMS is focused on utilizing all of our levers to make equity-based changes that impact all of our communities across every CMS program to help people live their healthiest, best lives. At CMS, each program is tasked to look at health equity, but the CMS Office of Minority Health has this as our mission to lead the advancement and integration of health equity across CMS's programs. Next slide. So on this slide is our mission and our vision, and we focus particularly on racial and ethnic minorities, people with disabilities, members of the lesbian, gay, bisexual, and transgender community, individuals with limited English proficiency, and rural populations, as well as others adversely affected by poverty or inequities. Next slide. CMS OMH serves as the principal advisor and coordinator to the agency for the special needs of minority and disadvantaged populations. And our responsibilities include providing leadership, vision, and direction to address CMS minority health and health disparities goals. We participate in the formulation of CMS's goals, policies, and strategies. We implement activities to monitor CMS health equity programs and share resources. We consult with federal agencies and external organizations to address health equity. And as the principal advisor on health equity for the agency, we work very closely with our colleagues in the CMS Division of Tribal Affairs, who works directly with American Indian, Alaska Native communities to enable access to culturally competent healthcare. The CMS Division of Tribal Affairs convenes the CMS Tribal Technical Advisory Group, or TTAG, to provide and advise and input to CMS on policy and program issues affecting health services in tribal communities. CMS OMH, DTA, or our Division of Tribal Affairs, and the TTAG partnership is focused on hearing from tribal members to ensure CMS's health equity efforts strengthen the healthcare system for all American Indian and Alaska Native tribes. Our health equity work will help to improve health outcomes in all tribal communities, and the input received from the TTAG, and especially through the TTAG Health Equity Subcommittee, will contribute to our efforts to achieve health equity as we think about this work as it relates to tribal nations. Next slide. Next slide, please. So I'm going to talk a little bit about CMS's health equity strategies, and I'll start with this particular slide that focuses on driving equity through executive order. In January of 2021, President Biden called upon every federal agency to implement a comprehensive approach to advancing equity for all, including people of color and others who have been historically underserved and adversely affected by persistent poverty or inequality. Here is the summary of the Executive Order 13985, which is entitled Advancing Racial Equity and Support for Underserved Communities through the Federal Government. And this executive order lays out a systematic approach to address inequities. This includes embedding fairness within the decision-making part of all government agencies, and it takes a very comprehensive approach to doing so. It lays out underserved communities as racial and ethnic minorities, people with disabilities, members of the lesbian, gay, bisexual, transgender, and queer community, individuals with limited English proficiency, rural populations, and persons otherwise adversely affected by persistent poverty or inequality. Next slide. So just a moment ago, Carrie started with definitions, and that's important as well as we work on health equity across our agency. So within CMS, our administrator has focused on our definition here as it relates to health equity. So health equity is defined as the attainment of the highest level of health for all people, where everyone has a fair and just opportunity to attain their optimal health, regardless of race or ethnicity, disability, sexual orientation, gender identity, socioeconomic status, geography, preferred language, or other circumstances. And CMS is working to advance health equity in 3 important ways that are listed here. First, in how we design, implement, and operationalize policies and programs that support health for all the people served by our programs. Secondly, focusing on eliminating avoidable differences in health outcomes experienced by people who are disadvantaged or historically underserved. And thirdly, providing the care and support that our enrollees need to survive. Our agency strives to advance progress in creating a care journey that is free from inequity, while optimizing opportunities, access, and outcomes for historically underserved or under-resourced communities. Next slide. So this focuses on CMS's health equity strategy. So building on the Biden-Harris administration's ongoing efforts to provide high quality, affordable healthcare for all people and drive health equity across HHS, CMS outlined an action plan that includes the following steps listed here on this slide. So just to name a few, closing gaps in healthcare access, quality, and outcomes for underserved populations. And in that definition, when we were asked to do the health equity definition, and the cloud produced some of the terms that you see here: healthcare access and quality. So these are some things that we're focused on at CMS. Promoting culturally and linguistically appropriate services to ensure understandable and respectful care and services that are responsive to preferred languages, health literacy, and other diverse communication needs is another priority. Building on outreach efforts to enroll eligible people across Medicare, Medicaid, CHIP, and the marketplace. I'll just skip down and talk about ensure engagement with and accountability to communities served by CMS, and policy development and the implementation of CMS programs. So, for example, the meeting today is an important part of us achieving this through engagement and really hearing from those served by CMS. And then lastly, I'll just point out here, promote the highest quality outcomes and safest care for all people through the use of the framework under the CMS National Quality Strategy as well. Next slide. CMS seeks to remove barriers to healthcare and services, and our strategic efforts to support a person's health and well-being are rooted in implementing policies and programs that support health for all people served by our programs. Our strategic work includes the CMS Strategic Pillars and the CMS Framework for Health Equity, which are foundational to achieving health equity in tribal communities. Next slide. Before discussing how we are operationalizing health equity at CMS over the next decade via the CMS Framework for Health Equity, I want to build an understanding on how CMS's health equity strategy connects to the CMS strategic pillars seen here on the screen. So each of these pillars represent a critical priority of our administrator. On the left, the first pillar is to advance health equity by addressing the health disparities that underlie our health system. And from this graphic, you can see that health equity is at the forefront of the CMS strategy. It is a strategic imperative to accomplishing our mission. CMS OMH is leading a data-driven approach to identifying structural barriers and uniting the agency to eliminate them. And we do this using a framework for health equity and a set of priorities put forward by our stakeholders and partners to help align and focus our work. And as we talk more about the CMS framework for health equity, I want to underscore 3 points. First, the people we serve as an agency will always be central to our work, no matter which end they are in. And so when we say that, we mean whether it doesn't matter if they're in Medicare, Medicaid, or the marketplace. We will continue to build on the Affordable Care Act and expand access to quality, affordable health coverage, to modernize the Medicare program, and address the high cost of prescription drugs to deliver quality care at a lower cost to the patients and families we serve. The people we serve, providers, plans, individuals, community organizations, to name a few, are what set our priorities, and we remain committed to adapting, adjusting, and course correcting to ensure we are meeting the needs of those we serve first and foremost. And again, I want to say a special thank you to the National Indian Health Board for the feedback that was presented to us on our framework that I'll be talking about shortly. Secondly, stakeholders will be engaged throughout the policymaking process. So for CMS, from whether it's a patient to a provider or to the communities we serve, we are striving to engage individuals throughout the policymaking process. And our office's commitment is to be able to clearly explain the actions that we're taking to our stakeholders and how it will help to improve health outcomes. And lastly, I'll just say the centers within CMS are working across HHS to tackle such issues as improving maternal health outcomes, advancing behavioral health, and being better prepared for the next public health emergency, such as our current pandemic that we're still working through. CMS is committed to working with states, tribal nations, US territories, health plans, and the provider community to be a driver of more integrated care that will ultimately better serve those who rely on our programs. Next slide. So building on the administrator's health equity pillar, CMS is working to operationalize health equity as outlined in our framework, and we intend to do this over the next decade. So this slide speaks to our anchor and our true north as we carve a path to equity across the healthcare system. Our guiding light for this effort are the communities we represent, the voices and the perspectives of those we serve. And we have decades of research to draw upon as we learn about the needs, barriers, and opportunities, about pressing and emerging disparities among members of our communities. But we also want to understand firsthand what the most critical needs are and what our partners who serve our communities feel CMS could do to have the most impact on health equity and eliminating disparities locally. We are focused on listening and valuing our stakeholders' feedback through the CMS Tribal Technical Advisory Group, through listening sessions and other communication forums to support people where they live, work, play, age, and worship. And I want to highlight that CMS will continue to engage with members from tribal communities on the framework to ensure we are bridging disparities in our healthcare system and improving access to care for all American Indians and Alaska Natives. And a special thank you to the NIHB for their feedback relating to the framework. So now I will talk about the framework in my last few moments. Next slide. So on this slide, we list the 5 priority areas included in CMS's framework for health equity. And as I said, these are our guideposts to operationalize health equity across our health programs at CMS. This is where we are focused over the next decade. So first, if you think about data, we must always focus on expanding the collection, reporting, and analysis of standardized data. Without data, we cannot see disparities or who is most impacted and where our gaps in quality, access, and outcomes are. And we are looking internally at expanding data collection and stratification of our data across our programs, thinking about health equity focused measures, and working to increase the ability of and access to CMS data for researchers and external partners. Next, consistent with the whole government approach directed in Executive Order 13985, Advancing Racial Equity and Support for Underserved Communities, and other executive orders focused on health equities and the populations we serve, we have operationalized the key tenets of advancing equity by the administration. And across all of our work, we're thinking about how to identify, understand, and address structural, policy, and operational barriers. So priority 2 focuses on assessing causes of disparities within CMS programs and addressing inequities in policies and operations to close gaps. So again, that is why discussions such as the ones that you'll be having today are important for CMS, because it will allow us to have a laser focus on how we address any type of barriers within our programs. So this reflects our focus on identifying and removing barriers our populations experience as they seek access and use of CMS supported benefits, services, and coverage. We are working towards this priority by focusing on bidirectional outreach to our communities to understand barriers. And this includes, for example, rolling back restrictive policies across Medicaid and increasing enrollment in the marketplace plans among underrepresented communities, and working towards building health equity reporting metrics into our quality improvement programs. Through priority 3, we focus on building capacity of healthcare organizations and the workforce to reduce health and healthcare disparities. So within this priority, we are continuously considering whether our providers and healthcare workforce have the tools they need to do work in local communities. We are paying particular attention to understanding and meeting the needs of providers, plans, and other organizations who disproportionately serve underserved communities to ensure CMS programs are structured in ways that allows these providers and networks to fully realize the intended benefits of these programs. Priority 4 focuses on advancing language access, health literacy, and the provision of culturally tailored services. And here we focus on helping organizations and CMS to implement the national class standards. So we're working towards ensuring CMS materials are available in multiple languages and at appropriate literacy levels, and that healthcare navigators are available to help consumers enroll in the right healthcare plan to meet their financial and healthcare needs. Lastly, priority 5, we are increasing all forms of accessibility to healthcare services and coverage so that all individuals with disabilities have improved access to quality healthcare, coverage, services, and benefits. So in addition to working to support providers in delivering disability competent care, we are also thinking about our health and safety standards with an accessibility lens. And of critical importance, we're working to promote broader coverage of services that address health-related social needs, such as nutrition supports, home modifications, wraparound housing supports, and other services like home health care and other, home and community-based services to help individuals age in place comfortably with the care and support they and their families need. So as you can see, we have a robust agenda ahead for the next several years, and we certainly welcome collaboration as we build the path forward together. Next slide. So I'm just going to briefly talk about some of the initiatives that are led out of our office, and 2 in particular that I'm going to focus on today. So next slide. You'll see here there's a suite of materials. I encourage you to visit our website and look at some of the resources that we have that may assist you as you focus on health equity. But in particular, I wanted to highlight our Health Equity Technical Assistance Program. And this service offers personalized coaching and resources, guidance on data collection and analysis, assistance in developing a language access plan or a disparities impact statement, and resources on culturally and linguistically tailored care and communication. So we offer this to anyone, whether it's an internal partner within CMS or an external partner. This is one resource that we have to assist you as you are thinking about health equity in your respective roles. And so you can reach our health equity team at healthequityta@cms.hhs.gov to get started. Next slide. And then I'll just briefly mention our Coverage to Care. This is another initiative that I'm really excited about. It is focused on increasing the consumer connection to care and eventually bettering health outcomes. So regardless of the consumer or insurance type, everyone can use our C2C products. We want consumers to understand their health coverage and actually use it to make an appointment with the provider who takes their coverage to receive preventive services and primary care. And this will help consumers to live, a long and healthy life. And so there's several resources available to assist partners and consumers in their journey. We have a roadmap to better care and a healthier you, which outlines 8 steps to connect to healthcare and to lead a healthier life. First is to put your health first, where we focus on prevention. So there's several ones here. I won't go into detail, but I will just end by saying that the roadmap is available in 8 languages, and we also offer a tribal version that gives specific information for American Indian and Alaska Native populations, including special protections in the marketplace. As I mentioned, C2C resources. C2C has several resources, including prevention resources. There's ones that focus on the financial aspects of health coverage, as well as enrollment toolkits. So I hope you will visit our website. Next slide. So I will just briefly talk about all the ways you can connect with our office. Next slide. Listed on this slide is our contact information. And we have several mailboxes listed here, and with the main one being omh@cms.hhs.gov. I encourage you to visit our website and to sign up for our listservs so you can stay up to date on all of our health equity related initiatives. And in closing, the framework presents opportunities to expand the impact of our partnership to further health equity, to operationalize levers of change that promote advancements in health equity, and to create sustainable solutions for equitable and quality care. And I am very hopeful the dialogue you are about to engage in today will continue to identify innovative ways to apply our priorities to further health equity. We still have a lot more work to do, and we can write this part of our journey together. And CMS is certainly committed to improving the healthcare of all American Indian and Alaska Natives. So again, thank you for the opportunity to be here today, and we're looking forward to the feedback. So thank you.
Thank you so much, Dr. McIver, for the overview of the 10-year plan, your priorities and initiatives. Now it is my pleasure to welcome our first keynote speaker, Dr. Malia Villegas. Dr. Villegas is an enrolled member of the Native Village of Afognak in Alaska, where she also serves on the Tribal Council. Dr. Villegas is a Alutiiq with family from Kodiak and Afognak Islands in Alaska, and Oahu and Lanai and Hawaii. Dr. Villegas serves as the Senior Vice President of Community